Okay, so our Snellen chart is completed. Christy do you have nearsightedness or farsightedness? Or both?
Wait, I think they're both are opposite. So nearsightedness. Can't see far away.
Okay.
Also have astigmatism.
Okay, great. Awesome. Do you have any problems with color vision?
No.
Okay. And I'll have you close your eyes. I see no lumps or any kind of deformities or problems with the eyelids. They're nice and moist. Now I'm going to do the extraocular muscle function, okay, which we already did the cover and uncover tests, and we did the cardinal fields of gaze, which actually we'll do one thing with the field of gaze. Can you follow my finger? Very good. And I'm going to use this otoscope to look at her light reflexes. And the pupils do shrivel as they want them to. They go to about a 1+ upon light. Yes, left and right sides both do that. Okay. The appearance of her conjunctiva, sorry. They are pale to pink, but normal. The sclera is completely normal as well, does not look to be yellow or discolored of any kind. Cornea does not look to have any visible lesions on it. Iris and pupil all appear to be normal, and lens appears to be normal as well. Next, we're going to do the auditory screening. We are going to do the voice whisper test, which I will ask her a few words and see if she can hear me, and I will go lower in sound. So I will start over here. Can you hear me? Can you hear me?
Yes. Barely, but yes. No.
Okay. And then next we are going to do the Weber test, which we work in an ENT clinic, so I actually have tuning forks for you today. And we are going to use the 256 tuning fork on Christy today. And I'll already do this. I will knock the bone on my shoulder, and then we will put it up to her parietal suture on her head to see which ear she hears it better out of.
You said shoulder.
Does it go elbow? Oops. Can you hear both ears?
Yes.
One louder than the other?
Can't tell.
Can't tell. Good. She passes. Okay. All right. All right. Upon external, we're going to look at her ears on both sides. And upon her external ears, I'll just take a look. The helix is completely intact along with the tragus. They all perfect and symmetrical. And they both have good coloration. They're nice and moist. They are patent, and I see no difference at the bottom of the where the lobe connects with the skin on the face. Let's see. Next, we'll look in her nose. All right. Should we wait? And the nose looks clear. No evidence of any mucous membrane tearing or scarring. No history of surgery. And it also is no presence of any allergic rhinitis or clear mucus coming out of there. I will inspect the sinuses and palpate and percuss and ask if there's any pain. All right. She doesn't complain of any pain. And I'll percuss those. Any pain?
Nope.
And it has a nice dull timpani that comes from them. So that indicates to me that there is no evidence of any fluid in either of the sinuses. All right, so as Christy's talked to me, I smell no different breath smells. This doesn't have a sweet or pungent odor to it. Lips appear to be clear in color, just the nude color, doesn't appear to be purple of any sort. And we're going to look at the tongue.
Ooh, I hate that one stick.
Give me a try some now. Say ah.
Ah.
All right. And she has a good gag reflex. It's nice and moist and dry, no lesions of any sort. Gums and teeth appear to be all healthy. Her throat also appeared to be clear in color, no evidence of smoking. We are going to skip the breasts and regional nodes section. Yes. And we are going to go to the lung section. Let's see. So we are going to auscultate for general breath sounds. So I'm going to have Christy lay back for me, and I will do the S1, S2, S3, S4. Okay, so I'm going to pick her up. Make sure that you can see me. I want to go back. There we go. Okay, we'll just put her back just a little bit. All right. So we're going to listen to the S1 and S2 sounds. And I'll have you take a nice deep breath for me. And again. And again. And one more time. All right. And we're going to have her continue to lay back. And I'm going to do the general palpation of the thoracic cavity. All right. All right, so we will ask her to take a deep breath and make sure that she's comfortable in this situation. We do not want her to feel at all uncomfortable. All right. And we are palpating for the kidneys along with the spleen. I know she does not have mono right now, so we're safe. Okay. And then I'm going to check for normal bowel sounds. Huh?
That's my double.
No, it's not. Oh, sorry. Sorry, Miss Rivera. And she has light bowel sounds. It does not appear to be heavy in nature. All things are normal flowing. Oh yes, there we go. And it is in the outer lateral quadrant that we're hearing these. Very good. I'm going to have her continue to lay. All right. Next, I'm going to check her jugular pressure. Which are normal. I'm going to check her carotid pulses one at a time. All normal. Okay, so next we're going to do pulses. And we can do the temporal pulse. We've already done the jugular pulse. And then we will also, we will do the popliteal pulse, which I believe is the foot. And it is a seems to be a little thready of a pulse. And I'll ask Chrissy to put her leg back. Make sure we can do foot, back, range of motion. And check for dorsalis pedis. All normal and reflex. Sorry.
That's alright, I should have left it off.
I see the color is all normal. I'm going to check capillary refill on her toe, which is only a few seconds, and it comes back to the nice pink color. Skin temperature is nice and warm. No edema, ulcerations. Skin texture is normal. Alright, sorry. Okay, just a couple things to go back on the abdomen. Contour and symmetry is completely normal. I see no evidence of striae, masses, nodules. Bowel sounds were normal once again. Percussion of the kidney, liver, and bladder, all normal. And yes, anytime you're going to palpate the bladder, you always want to make sure that your patient has used the restroom before. Okay, we're going to do a couple more things regarding range of motion, muscle strength. Okay, I will notice toe wiggling, normal. And, okay, so we're going to have Christy get back up.
Oh, I don't put my foot back.
Oh, good, right.
That's good enough.
Thank you. Alrighty. Christy's been an excellent helper today, huh? Alright, so first thing we're going to do, okay, so overall appearance, once again, normal. I see no posture issues. She's not sunken over or too far back. I'm just going to have you walk toward me. Make sure your gait is normal. Perfect. Okay, and I'm going to have you stand right there. And I'm going to have her do the Romberg, which have her put one foot in front of the other, close her eyes, and arms out. If she can't do it, it's okay. Perfect. She can do it. Okay. Let's see. She has no missing limbs. She does not use a walker or crutch. No history of tremors. No traction or cast. Spinal cord injury. Muscle size and shape on Chrissy is all normal upon appearance. And then we will also do a couple range of motion exercises. Try to see if you can push back at me. Then I'll push at you, you try to push me. Very good. Muscle strength normal, and hand grasps normal, and normal again. Okay. All right, we're going to inspect the temporomandibular joint. Any pain problems?
No, not now.
And I see nothing moving forward or going backward. Shoulders and elbows are symmetrical. Wrists and hands are all symmetric to one another. Knees, ankles, and feet are all also symmetrical to one another. I see no difference in length of limbs. And then I'll ask her a couple questions about her sleeping habits. How many hours a night do you sleep?
7.
Do you take naps during the day?
No.
In the morning or evening?
No.
Do you feel rested?
No.
Do you have difficulty with sleeping?
No.
Awakening at night?
Yes.
Early awakening?
Yeah.
Do you use any sleep aids or medication?
No. Yes. Yes, I do. I take amitriptyline.
She takes amitriptyline for sleeping habits. And let's see. And I believe that is it. So I hope that I've covered all bases today. And thank you again.